Okay, thank you. Right, so we'll start off with Dr. Gary Fuller from Imperial College London. Gary is an air pollution called the invisible killer. His research interests focus on urban sources of air pollution, how they are changing, how they affect our health. He'll be talking about how to achieve a smog-free city. And then we'll have Zak, if we can return back to the...
Oh, I'm sorry, I've shared too early.
After Gary's given his talk, we'll go to Zak, who is a Policy and Public Affairs Officer at Asthma UK and the British Lung working on the topic of air pollution. He has previously worked on policy campaigns in the charity sector on sustainable transport and environmental issues. It will cover the health impacts of air pollution and how it has an outsized impact on certain groups, including people with a lung condition. Then we'll have some opportunity for questions for both Gary and Zak. And at 4 o'clock, we aim to have Andrea Lee talking to us. And she is the Clean Air Campaigns and Policy Manager for environmental law organisation Planet Earth, which has successfully challenged the UK government in court for failing to meet legal levels of air pollution. Andrea has worked in climate change, sustainability and sustainable transport projects in the voluntary and public sector. The presentation will outline the basic legal frameworks governing action air pollution in the UK and why and how they need to be improved. But before Gary starts off, I'd like to ask just a couple of questions. I'm going to get some poll data, and I'd like to see how that changes before and after the speakers. So if I launch the poll, you should have 2 questions. Both are ranked from 1 to 5. Okay, we've had some votes coming in already. That's good. I'll leave the questions up for a minute or so. Okay, I'll end the poll there. And if I share the results, I'm not sure. Can you tell me if you can see the results? Is it coming up on the screen there? Okay, great. Okay, so it looks, for the first question, how much do you know about air pollution? There seems to be a fairly expert group among us. But people are going between 3 and 4 in how much they know about air pollution and the risks to health. This is interesting. And how empowered people feel appears to be at the lower end. So maybe people are aware of it, but they don't know what to do. So that's our target audience, and we'll see if the talks affect the results when we repeat the poll at the end. Okay, and with that, Gary, if you want to share your screen, we can start with your presentation.
Hi everyone, thank you Pete for the introduction. Can everybody see my screen okay? I assume so, unless I hear to the contrary. A lot of the conversations we have around air pollution are all about limit values and whether we achieve them and so forth. And I thought I wanted to talk about something a little bit different and think about the ways in really about how we've arrived at this point with the air pollution that we have today, and a few things about solutions and what our future smog-free city might include. If if I can advance my slides. I think Pete framed it in terms of thinking about air pollution in Haringey and air pollution in London and in the wider UK. And I thought I would start on an even grander scale and talk about the globe as a whole. There's a fantastic piece of reading I recommend, which is The State of Global Air. And I've shown the results here. You could just look it up on their website. I've shown the results here from the 2019 report. The 2021's available now. But you can see here that air pollution is the 5th leading risk factor for an early death. And it's far above many other much more well-known risk factors for dying early. It's estimated that around 4.9 million people are dying early each year, simply because of the poor quality of the air that they are exposed to. Where does most of this take place? You might think that our local streets are in a pretty bad way, but the main areas for air pollution is this sort of arc that extends across Africa all the way over to China. And if we think about the population of some of these countries, like China has a population of around 1 billion, so does India. We have Pakistan, Bangladesh, Iran, Iraq, and several really very populous countries in this corner of Asia. And we probably have somewhere in the region of about 40% of the world's population sitting here in this really polluted part of the world. Coming to London, there's been various estimates of the annual burden of air pollution, and we're certainly not immune to this. So in London, latest data from my colleagues at Imperial estimates that somewhere between 3,600 and just over 4,000 people are dying early each year due to the PM 2.5 and the nitrogen dioxide that we're creating and that everyone is breathing. So how did we reach this point? And I just wanted to throw in a few slides to show how our knowledge of air pollution has evolved over time. It's winter time in London, and if this had been winter in London 70, 80, 100 odd years ago, it would have been pretty smoggy on many days outside our windows, mainly because of the solid fuel use in people's homes, so mainly coal at that time. The December 1952 episode, I think, is probably well known amongst many people, and it's extra well known these days since it was on an episode of The Crown. But what happened here was over a smog that lasted slightly less than a week. And you can see here the dates in December with the concentrations of smoke, sulfur dioxide, and as they rise, it's quickly followed by a huge increase in deaths in the city. The initial report that came out attributed said around 4,000 Londoners had died during this time and the time that immediately followed it. But an analysis later said that it was around 12,000 people, not just from that peak, but because they'd been harmed and then died in the weeks and couple of months that followed. And I think it's awful that they have absolutely no memorial. This probably before COVID was the worst disaster to strike our city. And there is nothing, no memorial, nothing for those people that died at that time. So what did that teach us? Well, that taught us that peaks of air pollution, sudden episodes, really intense concentrations, shorten people's lives and kill people. So our management of air pollution at first set out to manage these episodes and to manage the coal burning in our cities for the large part. Our knowledge of air pollution had an enormous step change in the 1990s with this thing called the 6 Cities study. And what happened is researchers in the US followed a group of people across 6 US cities and wrote to them each year, sent them a card saying, "Are you dead yet?" And if they didn't reply, they sent out a researcher to go and find out what was happened. And they found that over time, if you look in the left-hand panel, you can see that the probability of survival split between these cities. Some people were living longer and some people were dying sooner. Now, there's lots of reasons why, from poverty and many other societal reasons. But when all of these were removed from the analysis, what they found was that the risk of an early death was proportional to what they called the fine particle concentration. So that's what we now know as PM2.5. And this told us that it's not just pollution episodes that are causing harm to people, it's the air pollution that we breathe on a daily basis, day in, day out, over a period, in that case, of about 14, 15 years, was shortening people's lives. The latest research has taken this a little bit further, and now what we are noticing is that the emerging evidence is not that air pollution just kills people in these intense periods of pollution episodes, or that the exposure that we have over several years causes us harm, but the exposure we have through our lives may be the main source of harm. And part of the evidence that feeds into this is a study that we did with kids in East London, and we found that because of the air pollution that they're breathing, kids in East London are growing smaller lungs. Now, this decreasing lung volume is something they probably won't notice themselves, but if you think about the elderly people that you might know in your family, and perhaps when they've got ill over time, there is a constant fight when they've had flu, pneumonia, and I suppose now we have this COVID issue with us as well, of a fight for air. And if you enter your old age with smaller lungs, is that going to be setting up a legacy for our future because of the air pollution that our children are exposed to today? London's air pollution, I don't really have any maps of current air pollution in London. It's very different at the moment. This is what it's like in a typical year, and you can see nitrogen dioxide and the main problem areas in the centre, and you can see the arterial roads running around, and everyone from Haringey, well, we're up in this patch over here, and then you can see Heathrow Airport, of course. But there's been quite a few changes in London's air over the last handful of years. And the most significant, I mean, it really is a significant and large change, is the ultra low emission zone, which has been introduced in the central area. Now, what the ultra low emission zone is often framed in the media as a charging zone. So, you know, people pay to go in, but in actual fact, it is a lot more than this. There is massive investment in cleaning up the fleets. So particularly by TfL, but also by others, cleaning up the fleets that are using the central ULEZ area. And if you look on this here, we have trends in nitrogen dioxide across the central area, and then in next to roads, and then we have in inner London as well. And we can see this change point here, where air pollution improves really markedly from about 2017 onwards to just before the current situation that we have at the moment. So there is this huge improvement in air pollution in the central area because of the ultra low emission zone. What would have happened anyway? Well, I won't go into the details of this analysis, but what we did working with scientists at TfL did was they had a counterfactual. What would have happened without the ULEZ? And that's the green line. And we can see that this difference here, which is really marked, is due to the ULEZ. And it's also brought about some changes in inner London as well, since the fleet that uses the centre also travels in inner London. I think it's also worth thinking about what would a smog-free city look like. And I did this project for The Guardian, and you can see the URL at the bottom, and presumably the slides will be available afterwards, so you can go and have a look. But if we're going to create a smog-free city, we need to be moving beyond debates such as should it be petrol, diesel or electric traction into getting our transport correct. We need to be thinking about getting heating right. We need to be thinking perhaps about what our cities actually look like, turning some of our roads, for instance, into parks and just changing our cityscape completely. This is Seoul in South Korea. And this is quite famous, but before this area, if you went back some years before this picture was taken, this was a multi-lane road that had been laid over the top of a river that went into the city centre. So with congestion really out of control in the city, rather than build more roads, what the city authorities did was they unmade roads. So they took out a major arterial road, turned it into a public space and a place where people can walk places, and air pollution, traffic in the city decreased. So it's one example of types of things that we can do if only we have the impetus and the imagination and the drive and leadership to do so. In terms of changes that we can make, in the UK, one of the most obvious things that we can do is to change the way in which we travel. Not all air pollution comes from transport, but changing the way in which we travel can bring about many advantages. If we move from just debating whether it's petrol or diesel or electric to actually thinking about let's move actively, then if we're walking and cycling, then we can tackle air pollution, we can tackle climate change, we can tackle urban noise that plagues so many, and there can be many advantages from just regular exercise in our lives, and which could really maximize the public health benefit that could result. For instance, if we all swapped 4 kilometres of driving per day, it's been calculated it would save the NHS an absolute fortune, as I say, and it gives benefits for air pollution, climate change and traffic noise. Does it actually work? Well, there was a study from UK Biobank where they looked at 260,000 of us, and they looked at people that were commuting to work for a 5-year period, and they found that people that were cycling were living longer than those that were driving, and people that walked to work had less heart disease. So it looks like it does actually work. Another thing that has been looked at a lot is these types of cycle hire scheme. We've got the London one, but this the first study that was done was in Barcelona, and when they introduced it, they were worried whether introducing the cycle scheme would actually do more harm than good. And their analysis found that yes, the cyclists have a slightly increased risk of accident and they're breathing more air pollution as they cycle around, but the benefits from the exercise that they obtain outweighed the disbenefits by about 70-1. So it's, you know, the opportunities to improve public health by active travel is just extraordinary. We often talk about cars, and we're so fixated in talking about air pollution, transport and cars that we forget about deliveries. Some work was done by TfL that found that of all the vehicles, vans that were driving around London all of the time, then less than 39% of them were less than a quarter full. They're just very badly utilized. So can we do something better to think about deliveries? And we need to as well, since, you know, people need to have things delivered. We need to plan our cities in different ways. It's interesting, a quarter of a van is, you know, perhaps somewhere in the region of 100 a bit kilos, which is pretty much the weight that can be easily carried on one of these cycle cargo bikes. Other things we can do, well, just think about the way in which you travel. We've done a lot of work on low pollution walking routes. The first one we created was to walk between Euston and St Pancras, and the majority of people that arrive at one station or the other walk along Euston Road between them, where they're sharing the air that they breathe with about 80,000 cars and vans and other vehicles per day. However, if you walk just one set of streets to the north, you can reduce the air pollution that you breathe by about half. And we can also think about the way in which we travel between different locations. If we travel across parks, and quieter roads, then we have the opportunity to reduce our concentration still further. However, if we are to move our cities forward, I think we need to be redesigning them as well. We need to be redesigning our streets. We need to be redesigning where things are. There is a tremendous temptation at the moment to think that one of the solutions to air pollution is not to solve it at source, but somehow is to clean up the air that is already polluted. And there's some examples of this around the place. This, for instance, is a green wall that's just north of Oxford Circus, and some reason somehow this bit of moss here is meant to be providing clean air for all of the people in the streets below, and that's really not going to happen. This giant tower is built in a Chinese city and is said to be cleaning the air in the city. But if you just think of the vast volumes of air that are out here, if this is cleaning the air for all of the people in these buildings out here, the air is going to have to be rushing in here at such rates that it's going to be dragging cars off the street. Another example as well is a lot of the green infrastructure that's being put around schools. And this green infrastructure here is meant to be improving the air pollution that is breathed by the kids in the playground and in the school, and it's not going to happen. We need to be cleaning and sorting air pollution at source. I realise I'm talking on for quite a few minutes, so I'll just speed through things. This is a slide here, and I'll just take you to look at it yourselves about NOx emissions, which is for nitrogen dioxide, and PM 2.5 particles in London. And the main thing I want you to take away from here is that it isn't just transport. There are so many other sources that need to be tackled, including when it comes to PM 2.5, things like cooking and the growth in wood burning at homes. The big sort of thing that's going to drive much of the agenda this year and for many years to come will be climate change, of course. And what we need to do is to ensure that the things that we're doing for climate change also improve air pollution and vice versa. And our track record on this has not been good. So we introduced the dieselisation of our light vehicle fleet for climate reasons. We've been introducing biomass, so burning wood, and things like combined heat and power. And what these have done is these have worsened urban air pollution. And you can see here they're in this area whereby they're meant to have a climate change benefit, though I think that's doubtful, but they're definitely not beneficial to air quality. So the solutions we need moving forward, and this work by Martin Williams here, who sadly died last year, includes things like nuclear, but we could debate that. But you can see these are the things that we need rather than some of the policies that we've used so far. I think it's really good. I think there's a real turning in the tide. I think there's a massive growing awareness of not only climate change, but air pollution. And when the world was more normal, we had events like this going on in our cities. And there's been things like school streets being created, which have had a new momentum in this COVID time as well. So there is tremendous drive for improving our air pollution. Lastly, I wanted to talk briefly about a new project that we're doing at Imperial with the mayor and with a technology provider called Clarity from the US and Bloomberg philanthropies, where what we're trying to do is to open up the opportunity for communities to take part in measuring London's air pollution. So what we're doing here is to integrate lower cost sensors with the London Air Quality Network's reference sensors. And to do this, we've teamed up with a technology provider from the US, and we're going to create a core network funded by the mayor at around 130 locations in London, expanding the places where we're measuring air pollution. And then from summer 2021, we're going to be opening this up so community groups, businesses and others can also join in this activity. Now, the small sensors that we have out there won't be as accurate as the reference instruments that are used out there, but you'll still be able to ask questions such as the hot spots and the good spots in my area. When's the most polluted time of day? What's the impact of things like road closures? Or you know, how can I help people just be more aware of air pollution locally? Though it may not be so good for assessing whether we meet legal limit values or not. For that, we'll have to rely on the reference network. So if you're interested, and if you're representing a community group and you want to join in with this, there's the opportunity to go to the Breathe London website and register your interest. And I just wanted to end with some positive views of what our cities could look like. And all of these places here actually exist, and for the most part they exist in London. And really, you've got to ask yourselves, when we're thinking about what our future cities would look like, do I want to live where I live at the moment, or do I want to live here? And I know which way I would vote, and that's where we need to aim. So thank you very much for inviting me along to talk. There's my contact details as well as the London Air website address. And if you're interested in finding out a bit more, I have written a book about air pollution called The Invisible Killer, which if bookshops were open, you would find it in any of them, but it can be bought from the usual sorts of online sources as well. Thank you very much.
Lovely. Thanks a lot for that, Gary. That was fascinating. And just to remind people that the recording will be available and slides as well. If you wanted to look through them at a more leisurely rate, then hopefully they'll be emailed out to you. A reminder, if you have any questions, to put them in the chat. And interesting follow up to the routes that Gary mentioned from traveling in different parts of London. It turns out that the pollution you're exposed to when you're traveling within a car is much higher than it would be if you're walking or cycling, partly due to the fact that the exhaust fumes from the car in front can be sucked up into your car and kind of hotbox it. So that's something else, another reason why not to sit in car traffic if you can avoid it. Okay, moving on now. We've got Zak, and I should be able to share my screen. So Zak, are you ready?
Yep.
Okay. Here we go.
Great, thanks, Pete. Yes, as Pete said, I'm Zak Bond. I'm Policy and Public Affairs Officer for Air Pollution at Asthma UK and the British Lung Foundation. Next slide, please, Pete. So we merged together in January 2020 to better help people with lung conditions in the UK. Bit of background to what we do: we provide support to people who struggle to breathe, to help them manage their condition and live well. We fund a lot of world-leading research to find new ways to prevent, treat and cure lung disease. And we campaign and undertake policy work to make vital, lasting change. Bit of background for you: lung disease is the third biggest killer in England, behind cancer and cardiovascular disease. I think those figures are obviously a bit different this year. And we've seen relatively little improvement on respiratory health outcomes over the last decade. We've been working on air pollution now for several years, and the organisation started working on the topic because people with a lung condition were coming into the organisation and telling people how much it was impacting their daily lives. And I'll cover most of that in my presentation. And of course, I should say, I mean, this year lung health has been at the forefront of all of our minds with this pandemic, which is a terrible health crisis and has changed so much and impacted so many. Today I'm going to talk a bit about how air pollution affects us all, but how it hits certain groups a lot harder, especially how it's affecting people with a lung condition. And I'll talk about some of the changes we want to see to make the world a better place. Next slide, please, Gary. Not Gary, Pete. So as Gary has touched a bit on, air pollution is a health emergency, and it is the single biggest environmental threat to health in the UK. And given that we have so many people with long-term breathing challenges now from COVID-19, who are also likely to be more susceptible to air pollution, protecting at-risk groups and making sure we improve the nation's lung health has never been more critical. There is no safe amount for anyone to breathe in, yet levels across the UK are high in many places. Gary's covered most of what air pollution is, and you know, it's anything in the air that can harm your health. Some pollutants are more harmful than others, and levels of pollution vary across the UK, but we do have higher levels in towns and cities, and some of the highest levels in London, where we all live. Next slide, please. And Gary has spoken a lot about PM2.5 0.5, and this helps you get a bit of a grasp about what kind of the size a particle of PM2.5 is. So that's a human hair there, and PM2.5 is the tiny little pink particle there. And Andrea is going to touch a lot more on this, I think, in hers, but we should know that we are meeting our legal limits for particulate matter. That's only because the legal limit is twice as high as what the World Health Organization recommend. And if we're looking at Haringey, next slide, please. We're part of a thing called the Task Force for Lung Health, which is a big coalition of organizations who are helping to improve lung health. And they have an excellent data tracker. And as part of that tracker, you can look at air pollution levels in your area. So this is what it looks like for Haringey. So you can see we have very high levels of particulate matter. And the highest road is the A10, which I'm sure many of you will know, with levels of 15.4. So that's well above the 10 that the WHO recommend. Next, please. So as Gary has said, and it seems a lot of you already know, the air pollution has a really serious health impact. So it affects all of our health across our lives, but it has a long-term effect on all of us. So it can increase people's risk of lung disease, cardiovascular problems, and there is also growing evidence to suggest that it can cause new cases of asthma. And the Committee on the Medical Effects of Air Pollution has estimated that air pollution can be linked with up to the equivalent of 36,000 deaths every year in this country. And for people with a lung condition like asthma or COPD, that's chronic obstructive pulmonary disease, it can make their existing condition worse, especially when levels are high. And we know that children, older people, those on lower incomes, and people with lung conditions are being hardest hit by this problem. And I'm sure everyone on this call will have heard about the powerful case of Ella Kissy-Deborah, who was a young girl in South London who had severe asthma and sadly passed away almost 8 years ago. And for the first time ever, the coroner found that air pollution was a causative factor in her death. So we, of course, predominantly come at this thinking about the impact on people with a lung condition. And for the 1 in 5 people that will get a lung condition at some point in their life, air pollution poses a real and immediate threat to both your physical and your mental health. So we speak to a lot of people with lung conditions across the UK, and they tell us so much about how air pollution affects their daily lives. It makes their condition harder to manage, it can affect their ability to live a normal social life and effectively access treatment, and it can have severe mental health impacts. So in a survey we recently completed, we found that 88% of people with lung conditions said that air pollution affects their health and well-being. And it has physical effects. So a spike in air pollution can lead to people's symptoms getting worse, flare-ups, asthma attacks, and that can even lead to hospitalization. There's really robust academic evidence of a clear link between high levels of air pollution and increased numbers of patients with breathing problems. For example, a few years ago, the British Lung Foundation funded a study which found that you could quite clearly see when there are high air pollution levels, more people were being admitted to hospitals and GP surgeries with breathing problems. And we found that about 63% of people with a lung condition can feel out of breath on high air pollution days, and 54% have increased coughing due to air pollution. And we also found that about 7% of lung patients have had to visit hospital or seek emergency medical care. I mean, 7% isn't a huge number, percentage, but when you think there are millions of people with a lung condition, there's a lot of people who are having a bad time from this. And as this quote from Cheryl, who lives down on the South Coast, shows, for people with a lung condition, it's not just a statistic, it's not just a headline in The Guardian or a new study, it's something that really deeply affects them. And it affects, as I said, their physical health, and then that has knock-on effects on mental health and quality of life. So we've done a lot of focus groups across this year, talking to people about air pollution, and they said that it can leave them feel trapped in their own home. So 60% of people with a lung condition affected by air pollution have told us that they feel discouraged from leaving their home due to air pollution at some point. And I think, you know, if you imagine waking up each morning and having to decide whether leaving your house is worth ending up in hospital for, that has really strong knock-ons. Next slide, please. We've also found that it can affect people financially. So some participants in our research told us that air pollution can leave them being unable to work. So one quote here, I've applied for ill health retirement, and from my job in London, as my bronchiectasis and asthma are too strongly affected by air pollution. I'll give you 30 seconds to read that slide whilst I drink some water. And we also know that air pollution has a really strong interaction with health inequalities. So studies show that many of the poorest people in the UK are more likely to live near busy roads. In one 2011 study, 85% of people living in areas with illegal levels of NO2 were also the poorest 20% of the population. And this is a massive injustice, given that there is less car ownership in lower income groups. So it's often the very people who contribute least to air pollution who are being most burdened by its health impacts. And lung disease is a major factor in health inequalities as well. Someone from the most deprived section of society is 2.5 times more likely to have COPD and nearly twice as likely to develop lung cancer as someone from the least deprived section of society. Next slide, please, Pete. And air pollution has a really big impact on little lungs as well. So 1 in 11 children in the UK already have asthma. So taking action on air pollution is critical to improve their lives and possibly to stop more conditions forming. We need to tackle air pollution so that we can ensure that the next generation can grow up happy and healthy. And more locally speaking, we know that children in every London borough are being exposed to worrying levels of pollution. Sadiq Khan's own research has shown that 98% of schools across London are in areas which breach the WHO's annual guideline for PM2.5. We know that breathing polluted air can cause irreversible damage to children's growing lungs and hearts. Research by academics who were at the time at King's, but have of course moved with Gary, showed that cutting air pollution in London by 1/5 could result in almost 8,000 fewer children with low lung function each year. And as I've touched on before, there is also growing evidence, although not conclusive, to say that exposure to air pollution might be causing new cases of asthma. Next slide, please. So clearly, this is not acceptable. There's a big problem here, and air pollution is affecting some people more than others. And there are some things that we can do to tackle this, and totally agree with everything Gary said about making the future city. Some of the ways we can get there, and Andrea will talk a lot more about this, I think, but we need new clean air laws. So we need to underpin all action by ensuring that world-leading health targets are set out in law, including setting the World Health Organization's guidelines for fine particulate matter. This would ensure that everyone gets a base level of protection across the country, and it would drive cross-departmental action to tackle all sources of air pollution. And I think that does need to be joined with a strong and effective exposure reduction target to make sure that we don't just sneak under the target everywhere, pat ourselves on the back and move on, but keep pushing pollution levels down until we have eradicated human-made pollution. And fundamentally, as Gary touched on, we need to tackle emissions from transport, which is a major source in towns and cities. To do this, we need 2 major shifts. So first, we need to move as many journeys away from private cars towards walking, cycling and public transport as possible. And then second, any remaining trips need to be taken in a greener form of transport. Essentially, we need to see the end of the internal combustion engine, but we should also be aware that EVs are a source of particulate matter. In London, those shifts can be helped by the expansion of ULEZ, which we must make sure goes ahead next year. In central London, the ULEZ has cut NO2 levels by like 44%, but much more of London needs to benefit from this. Luckily, Haringey is, and the ULEZ is coming later this year, but I think the ULEZ probably should go further and farther than it is at the moment. And then we also need to see strong borough level policy that makes it easier, safer and more pleasant to walk and cycle. And I can see some brilliant campaigners on that issue in the chat. We also need to see plans that protect those who are most affected. So we need to see specific action around the school gate, such as school streets and behaviour change programmes that take people out of their cars and onto their feet or bikes to get to school. And the Mayor of London's school audit programme has been a good example of policy in this area. We also need to see action around hospitals and GP surgeries. Given a large amount of the pollution at many hospitals is due to roads situated close to the hospital, we need to see traffic reduction measures where possible put in place on those roads around hospitals. to minimise that traffic-related pollution. Excitingly, NHS England launched its net zero NHS plan recently, and in that they outline plans to reach net zero carbon emissions by 2045. So a lot of the stuff in that will go a long way to reduce the NHS contribution to air pollution, but we need to see more action. And we also need to see a complete revamp to the way that air pollution data, information and advice is communicated to patients and the wider population to make sure that people are aware of air pollution, can make changes to their behaviour to tackle air pollution and also protect their own health from the health impacts of air pollution. And for people with a lung condition, that information can be life-saving, but at the moment it's hard to access and to understand. We are putting out a new report this coming week, which I hope you'll all read, which will outline a lot more of policy solutions in detail about how you can protect vulnerable groups. And hopefully the Haringey Clean Air Twitter account will be able to share that so you can all see it. Next slide, please. So just to conclude, hopefully I've made sure you know that weakened and growing lungs are most at risk from air pollution. And as the case of Elikisi Deborah has showed, air pollution is a killer. We know that dirty air is unfair and unjust. It is worsening the UK's already startling levels of inequality. We know that car ownership is lowest on those who are most exposed. And I think, we can talk about this later, but I think we should be worried that air pollution could get even worse as we recover from COVID. We've seen some significant shifts in how people get around during the pandemic. There's been a really welcome move towards walking and cycling, and working from home has become an option for so many of us. But confidence in the safety of public transport has taken a significant hit, and there is concern that car use could significantly increase beyond previous levels when we move back to normality. And COVID-19 is having such a significant economic impact on society, and that might mean that people find it harder to upgrade to a new cleaner vehicle. It might mean that less money is invested in public and active transport, and there might be greater backlash to charging schemes such as clean air zones around the country. So these behavioural and economic shifts might make efforts to tackle air pollution even harder, but we must keep the pressure up on politicians to ensure that they persevere and ramp up ambition to clean up the air. And it's crucial that that happens. We know that tackling air pollution is critical to improve the lives of people with a lung condition. It can help reduce asthma attacks, assist in protecting the NHS. We can reduce health inequalities, prevent new lung conditions, improve the resilience of the UK population to respiratory conditions as well. Thank you.
Lovely, thanks a lot for that, Zach. Very, very interesting. And I've been scanning through some of the questions that people have sent, and I'm going to reserve some for the end. But we've got from now until 4 o'clock to answer some questions. But I'm going to target them only at the people who have spoken so far. So if Gary, you can unmute yourself and show your video. I've got the first question here from Dalip. He asks, with a rise in electric vehicles, especially in London, how is there a way at the moment to control the tyre and brake pollution that's created from these vehicles?
It's really, really challenging. Tyre wear, brake wear, road wear. I mean, if you own a car, you'll realise that you have to put new tyres on it. You have to put new brakes. And if you look at the road outside your house, you'll see the road markings disappear. These things wear out. And some of this wear ends up in the air, which we're breathing as particles. Some studies have found that electric vehicles, simply because they're heavier, produce more wear of roads and tyres. Which compared with petrol and diesel vehicles. So it is a major problem. The ways to reduce it is to make the vehicles lighter. And the good news is that electric vehicle manufacturers, for reasons of range and so many other things, are working really hard to make vehicles lighter. Another one is, if you've ever driven an electric vehicle or a hybrid, when you hit the brakes, it doesn't brake in the normal way, but it puts that energy back into the battery. So rather than braking, if you like, it puts the electric motors into reverse, and that can save so much in terms of brake wear. But we think about electric cars and their extra mass, but we also mustn't lose sight of petrol and diesel vehicles, because they're getting bigger and bigger all of the time, or heavier and heavier all the time anyway. Faster than the engineers can engineer new ways to make lighter vehicles, the people that want to market cars are introducing things like electric windows, air conditioning, navigation systems, and all of these other things that just make the cars heavier. I think really, however, it is the wrong debate. We shouldn't be talking so much about petrol, diesel versus electric. What we should be thinking is vehicular transport versus active travel, and making that our main mode shift instead.
Yeah, okay, that's a very good point. And the next one is for Zak, and this is from John. He asks, how does air pollution affect COVID-19 morbidity?
Yeah, and I'm just on the question that Gary's answering. I think we do need more ambition on that modal shift debate. If we look at Paris, they're greening the Champs-Elysees. You know, where is that level of ambition in London? Oxford Street is one of the most polluted streets we've got. And then on air pollution and COVID, so there have been some initial studies that suggest that air pollution exposure could increase your vulnerability to the most severe impacts of COVID-19. I think it is still an issue of debate in the scientific community. We've had papers from Harvard that say it does. We've had a big study from the Office for National Statistics, which said that maybe it doesn't. But what we do know is that air pollution contributes to the development and exacerbation of long-term respiratory and cardiovascular diseases. And those very conditions can increase people's risk of severe outcomes from COVID-19, including hospitalization and death. So we don't know if there's direct link, but we do know that there is kind of a comorbidity link, that people who have been exposed to air pollution over their life are more likely to have a condition like a lung condition, which is then more likely to affect them when they get COVID.
And there may also be trends there with the people from low socioeconomic backgrounds suffering more air pollution as a result of the area that they live in.
Exactly, yeah.
Could I just comment on that? And I think this is one of the things we don't talk about enough when it comes to air pollution. A lot of the focus is on doing something about air pollution from transport, because many of the people that are affected live in urban areas. And we debate less the sort of environmental justice angles of it. The most polluted places in most cities, I don't live in London, the most polluted places in my city are, the people there don't own vehicles for the most part, because that's the city centre. And there is a real injustice that people who are living in these areas are being polluted by people who are driving in from the suburbs, for instance. But we can see so many other dimensions of this. And it's been found that, people who are poorer contribute least to air pollution, but yet experience it to the greatest degree.
And the next question from Giovanna kind of links into this. He asks if the impact of plane fumes or incinerators affects people's ambient air quality enough to the point that it's dangerous. And I can ask you, Gary, initially, if you wanted to.
Yeah, there's two different answers. Incinerators, we did a massive project across the whole parts of the MRC centre, for which we're part of, where we looked at all of the UK's incinerators, and we really went to some lengths to try to, not just model their impact, but also to detect air pollution from them. And we could really find very little evidence that there was air pollution from modern incinerators that was impacting on the communities. Although when we did some studies around some birth outcomes around incinerators, it left what I can only put as probably some unanswered questions. We couldn't conclusively rule out certain issues around them, but they were kind of unanswered questions more than anything else. Airports, yeah, so we know about the issues to do with Heathrow and nitrogen dioxide, and that was one of the reasons why its expansion has been delayed and held back for some time. New evidence, though, excuse me, is pointing to pollutants that we don't really focus on from air pollution, from aircraft. I mean, if we instead look at counting particles, so this highlights the extremely large number of really tiny particles that we breathe. They don't weigh very much, so we don't measure them as PM 2.5. If we look at those, then airports are a colossal source. We did a study which was published about a year, 18 months ago, where we've actually managed to, in making measurements in central London, we've managed to detect tiny particles that originated at Heathrow. And we've done the same in, or working with collaborators in other European cities. And there's some open questions on whether these tiny particles or the number of them that you breathe might be affecting your health. And there's increasing evidence that probably it will. But if you think about Heathrow, and we're detecting particles from Heathrow in central London, then several millions of people will be exposed to the emissions from this airport. And it's exactly the same in airports near other European cities. And that is a very, very big cause for concern, I think, and for the future of our airports and aviation industry.
When you say small particles, are you talking about PM 0.1?
I'm not sure. For the technical answer is generally particles around the 20 nanometer size. But if you think about this, you could. I'm not sure how to explain this. There's a number of hypotheses about how air breathing in particle pollution affects our health. And one hypothesis says that if you breathe in one large particle, your body has to deal with it in, let's say, one part of your lungs. If you breathe in the same mass of particles, but they're really tiny, it could saturate the whole surface of your lungs, and your body has to deal with it over a much larger area, and it could cause a lot of, systemic inflammation and other things. So there's this hypothesis that says that we shouldn't be focusing so much on the mass of particles that we breathe, but the number. You could think about it in your own house, for instance, wander into the kitchen, think about dropping a couple of kilos of potatoes on the floor, and if they're baking potatoes, it's pretty easy to pick them up. If you drop a couple of kilos of sugar or rice on the floor, then it's going to scatter over the whole area, and you're going to be dealing with it for ages. And it's exactly the same with our lungs. So there's a potential issue there going forwards, I think, that we really need to focus on.
So there's a follow-up question which links very nicely to that from Dalip again. Where in the lungs does different levels of PM end up, and do any of them end up in the blood? That's a question for Zak.
Yeah, Gary might be able to answer it better, but one of the reasons we're worried about PM 2.5 is that they can get deep into your lungs and then probably travel around the bloodstream from there, as opposed to larger particles, PM 10, which probably get picked up in your breathing pipe.
Cool. Yeah, and Aisha asks, how serious are restaurants with open fires or that have a lot of cooking going on? How dangerous are they?
Shall I try that one? Yes, we're finding that the sources of air pollution are becoming, well, not becoming significantly bigger. It's probably more to the point where we're being more successful in controlling the other ones. We do find cooking particles throughout central London, which is the main places we'd look for them. It's really quite sophisticated kit to find them. And we find them around lunch times, we find them evening times. And I'm not sure so much about restaurants with open fires, but anyone with an open fire, you're contributing a huge amount to air pollution in your neighbourhood. If we look nationally, the largest source of primary PM 2.5 particles in the UK is coming now from the home burning of solid fuels, and for the most part that's wood. Going back to the cooking, we think, off the top of my head, I think it's somewhere in the region of about 10, just over 10% of the particle pollution that's emitted within London is coming from cooking.
From a personal stance, I know that when my dad does a fry up, that's when I've got to exit the house.
Oh, sorry, I shouldn't laugh. Yeah.
But yeah, I think generally frying foods is a really bad idea in a small confined space without ventilation. So if you do end up by having a fry up, always open your windows.
Or use your kitchen extractor if you have one. Yeah, no, it is really important, and we don't talk enough about air pollution indoors, and cooking is a large factor in that. Okay, now that's the end of the initial questions. We'll move on now to Andrea. Are you with us? Can you hear? You all right?
I am. Hello.
Okay, great. And did you want to share your screen?
I will have a go. Okay.
If you want to go into presentation mode, then that will come up as a full screen.
Yeah, computer's just a bit slow. Just need to just let it just yeah, decide when it's going to do that. But yeah, should I just start while it's deciding? Yes. So yeah, thank you very much for inviting me along to talk. It's always great fun with the things like this. Yes, that's better. So for those of you that don't know us, Client Earth is an environmental law charity. We use the power of the law to protect the health of people and the environment. And for us, really, like those two things go hand in hand. And clean air, in particular, is a good example of how the environment and the health of people are inextricably linked. As both Gary and Zak have mentioned, there are a lot of reasons to be concerned about air pollution and wanting to protect people's health from it, and has been mentioned as well. I was going to raise the issue that it's also a question of inequality. So I think, as Gary highlighted, quite often find that people on lowest incomes or people from ethnic minorities are disproportionately affected by air pollution, and in many cases are not necessarily the ones that are causing it. So there's an issue of the urgent need to protect people's health, but also air pollution in many ways is a symptom of the various social, environmental and health inequalities that people in our communities are suffering. So this is why, for example, this has been one of the areas of work that Client Earth has been focusing on over the past decade, really, and a bit longer. We have used the law, as some people might know, to try and further the need for try and push the government and others to take more action on air quality. So before I sort of get into an explanation of the various legal frameworks, I thought I'd just mention how, the work that we've been doing from a legal perspective, which is, as some of you might know, the fact that across the UK there are illegal levels of air pollution, and this concerns, as has been explained before, levels of nitrogen dioxide, which is a toxic gas. As Zak and Gary have mentioned, we also do have a problem with particulate matter, but we currently comply with the existing legal limits of air pollution, so we haven't been able to effect much pressure on that through the legal means at the moment. So really our work to date has really focused on trying to get urgent action on addressing illegal levels of nitrogen dioxide. So these legal limits should have been met in 2010, and in 2010, it was found that 40 out of the 43 air quality zones that the UK is divided into didn't comply with the legal limits. And that's why we started our legal action. And unfortunately, even though, as I'll explain, we have driven some action from government, we're still in a state where 33 out of 43 zones still don't comply with legal limits. And that just shows how difficult it is to get government to take serious action, and that's why we need legal pressure. We also need political and public pressure to demand that they do something ambitious about it. Our legal fight started back in 2011 when it was found that we hadn't been meeting those legal limits. The first legal challenge took 4 years, so legal actions are not necessarily very fast, but it took so long because there was a lot of legal questions thrown up by our challenge, and initially the courts in the UK, so we started off in the High Court and then had to go to the Court of Appeal. The courts were not didn't disagree that there were not illegal levels of air pollution. In fact, the UK government acknowledged that there were illegal levels of air pollution, but the issue was for the courts as to what they could do about it. So this had to be taken in the end to the Supreme Court, which threw some questions to the European Court of Justice, and that came back saying that when governments are not complying with legal limits, then courts should be ordering them to take action. And finally, in 2015, the Supreme Court agreed with us that not only was the UK still breaching legal limits of air pollution, but that it needed to take urgent action and develop a plan to show how it was going to meet legal limits in the shortest time as possible. We've had to take the UK government back to court a couple of times since then because we've not agreed in the way that they have implemented the court's decision. We've also won twice, which shows that the courts agree with us that the government haven't been doing enough. But some action has been driven, and we've seen in England, for example, 61 English local authorities have been directed to carry out feasibility studies to find out ways that they can meet legal limits in the shortest time as possible. We've also had commitments by the Welsh and Scottish governments. We've had improvements in London in terms of the ULEZ being brought in sooner, and also a commitment from the mayor to expand the zone in October this year. And in March, the existing low emission zone, which covers the whole of Greater London, the standards under that will also be stricter. So that will help to address some of the problems as well being faced across London. We've also seen the government give local authorities much more funding than they ever have, almost 1 billion worth of funding has been given to those local authorities that have been ordered to take action. This compares with the regular annual budget that of around 1 to 3 million that English local authorities have to bid for. So a huge increase in resources there. And we've also seen some national fiscal measures in terms of changes to the tax regime to try and discourage the use of diesel, and also encourage the uptake of ultra low emission vehicles. But there's still a long way to go, and the problem has been that the UK government has really taken a position of passing the buck down to local authorities, who are not always in the best place to implement ambitious measures, partly from resources, but also because of local politics. And we're seeing the implementation of things like clean air zones, which are similar to ultra low emission zone, the ultra low emission zone being delayed. A lot of plans are still yet to be finalised, years on from when they should have originally been done. We've not seen action from Highways England that controls outside of London a lot of the sort of big roads between towns and cities. We're seeing, unfortunately, slow and weak progress by the Welsh and Scottish governments. And we're still not really seeing enough of help and support being given to people and businesses to move on to cleaner forms of transport either. But I guess now I'll sort of explain how we were able to, you know, what the legal framework was that allowed us to take the UK government to court. And we often talk about the right to breathe clean air in the UK. And that right to breathe clean air we defined as the ability to hold the government to account over a certain standard of air quality. And this comes from predominantly a bit of legislation that's called the Air Quality Standards Regulations. And some of you may be aware that this actually originates from an EU directive called the Ambient Air Quality Directive. But it has been transposed into domestic law. So despite Brexit, it's still in English law, so these legal limits still do apply. And what these regulations do is that it places an overall responsibility on the UK government to take responsibility for the UK complying with legal limits. The responsibility is also devolved, so down to the devolved nations, and also in part to the Mayor of London. And these regulations, some of the key things that they do is that they set these legal limits and deadlines that they must be met. And when these are not met, it also sets a number of requirements, and the most important of that is the development of air quality plans that includes appropriate measures that would keep the exceedance period as short as possible. And I'll talk a bit more about these plans and what the legal test is for these plans. So that's really the sort of legislation that we've been able to use to take the UK government to court. We often get contacted by people who want to take their local authorities to court because obviously a lot of people across the UK are concerned about air pollution in their local areas, and they are disappointed often by what they see as very little action by local authorities to do anything about known problems. The issue of why this is quite difficult is because as I mentioned before, the air quality standards regulations that set those legal limits really places the overall legal responsibility on the UK government. What local authorities have a lot, the work that the local authorities have traditionally done on air quality sits under the local air quality management system that was developed under the Environment Act 1995. And this is the framework that local authorities have been working under. So what local authorities have a duty to do is to assess and review air pollution in their areas against national standards and objectives. In terms of values, these national standards and objectives often mirror what the legal limits under the air quality standard regulations or the EU directive are, but they are not legal limits. They are known as national standards and objectives. Where these national standards and objectives are not met, then local authorities have a duty to designate air quality management areas, AQMAs, and develop an action plan in pursuit of the achievement of air quality standards and objectives. And so that's a big difference. Under the regulations that you'll see on, I think on the left, the air quality standard regulations, the government has to produce a plan which has the appropriate measures to us to keep the exceedance period as short as possible. This is like, they have to do it. Whereas what local authorities have to do when they produce a plan is to produce a plan that works towards meeting these achievements. And I don't know, there might be lawyers in the audience. I am not a lawyer, but I work with lawyers, and there's that difference between having to do something and being very clearly defined in the regulations. And under the local air quality management, really all that local authorities have to do is to try to meet these national air quality standards and objectives. And that partly reflects the fact that, you know, obviously there are things that local authorities can do, but air pollution is, there's a lot of transboundary issues. Air pollution doesn't keep to local authority boundaries, it travels. There are also a lot of national policies that local authorities have no control over. So, you know, we talk a lot about diesels and the problem that the increased share of diesel vehicles on our roads has caused. Local authorities we're not in control of the, you know, the sort of fiscal regime that was encouraging people to take up diesels over the past couple of decades. So, you really can't make them completely solely responsible for air quality in their areas, because they are affected by sources outside of their control, and also policies outside of their control. So that's why when we get people asking us a lot about whether they can sue their local authorities, that's why it's not as clear cut, and it's very different from the work that we've done, holding the UK government to account. Just to kind of emphasize a bit of why the air quality regulations that have come from the EU are quite strong, is because they set out these tests that was defined by the High Court in our second legal challenge. And this talks about the fact that air quality plans must aim to comply with legal limits in the shortest time as possible. They must choose a route which reduces exposure as quickly as possible. So that means that, if you can take action that helps to protect people from exposure to air pollution, you must take it, even if that doesn't necessarily result in achieving legal limits. You have to do everything you can to protect people's health. And you have to ensure that meeting these legal limits is not just possible, but likely. And in addition, for those of you familiar maybe with how local authorities and public bodies make a lot of decisions, there's the determining factor. And often policies and measures in public authorities, the decision is based partly on the cost-benefit analysis. But in this case, the law is quite clear that when it comes to trying to decide between two measures that maybe have the same outcome in terms of reducing air quality, you can't be thinking about cost as the primary factor, or political difficulties. Really, the primary determining factor has to be, which is the most effective, technically feasible measure that you can do. And so this is also quite powerful, because local authority, public bodies, the UK government can't hide by the fact that something might be too expensive. They need to be taking action. I won't go too much into what needs to be done, because I think a lot of that's been covered by Zak and Gary. But obviously, we've been talking a lot about the different, from a legal perspective, I guess there's an urgent need to tackle the illegal levels of air pollution. And I know sometimes people criticize this position as, lawyers wanting to just purely to seek compliance. And compliance can sound a bit like a bit of a dirty word, but for us, the reason we're pushing for this is because, as far as we can see, meeting compliance is a way of driving action that will help towards protecting people's health, and that's why we want to do it. It's not because lawyers like to tick boxes and like targets to be met just for the sake of it. We're doing this because it's really important that we drive down levels of air pollution as much as we can, and meeting compliance with legal limits is one way that we can use the law to do this. We do need to go further, and we've talked about, especially with road transport, thinking about fewer vehicles, not just cleaner vehicles on the road, and the need for a comprehensive long-term strategy, as Gary has also pointed out. We need to be looking at other sources of air pollution as well. And from our perspective, I guess a lot of that is also dependent on having stronger laws that could make the UK a world leader in clean air. The laws that we've got through the directive have helped to deliver, a lot of action that wouldn't have happened otherwise. But nothing's perfect, and there is a problem between this confused parallel system with the EU, the regulations that drive the meeting of legal limits and what local authorities do. So alongside a number of other NGOs, we've been calling for the need for new clean air laws for a while, and some of you might be familiar with the Environment Bill, which presents a current opportunity to get some of those additional, more robust laws in place that we need. Unfortunately, some of you might be aware that just last week, the UK government has announced that it's yet again postponing the passage of the Environment Bill because of not having enough capacity in Parliament to discuss, which is very disappointing. But we're hoping that it will be an opportunity for the government to rethink its position on some of the key priorities that we've identified with partners such as the British Lung Foundation and the British Heart Foundation and others, on how to improve the Environment Bill to make sure that it does deliver stronger protections. One of the key calls that we're asking for, as Zak has already mentioned, is the need for stronger targets. This heat map of London shows the annual mean PM2.5 concentrations for 2016. This is where the current legal limit sits. So you can see that most of London, if not all of London, is fine under current legal limits. But if we were to apply the levels set by the WHO, you'd see that there's a long way to go in London. And PM2.5 is a very harmful pollutant. And we have seen through the need to be taking the UK government to court 3 times that if there's no legal pressure and there's no political pressure and there's no public pressure, the government isn't necessarily going to be jumping up and down to take action. So we think that stronger binding targets are essential to make sure that a direction is set towards reducing air pollution and better protecting people's health. We also need things like better plan making that requires concrete and coordinated action between different authorities and public bodies to deliver the targets. And we also want to see a new clean air duty, which will ensure that all actors play their part. As I explained before, we've got this problem where the legal limits currently, the responsibility sits with the UK government, and we think that it definitely needs to be led by them. But it gets very difficult when it comes down to other public bodies like Highways England, which is not taking action, and also local authorities, for example, as well, which, unless they have been directly mandated by the UK government to take action, are not responsible or don't have to necessarily think about the legal limits in their day-to-day activities. So we also get contacted a lot by people who are concerned about developments and how they might affect air quality in the areas. We know there's a lot of concern from people, as Gary's mentioned, from things like domestic wood burning. There's all these sort of issues that need to be better regulated and enforced by public bodies to really try and drive action and protect people's health from what we've heard is the single largest environmental health risk in the UK. And underpinning all of this, obviously, especially now that we've left the EU and we don't have the enforcement powers from the European Commission, is that we need a strong and independent watchdog. And that's one of the key things that the Environment Bill is meant to be delivering through the Office of Environmental Protection. But it unfortunately doesn't look like it's going to have a strong enough bite. The government has introduced a number of amendments, which we and many other NGOs are concerned and legal experts are concerned substantially weaken this watchdog. And the quote I've included there is from the judge who oversaw our second and third legal challenges. And really he sort of outlined how important it is to be able to keep an eye on government to make sure that it is taking action. And it's not necessarily, I mean, I think that it's very important that the public and the NGOs can hold the government to account, but we also need a strong and independent watchdog that, as the judge found out that the history of the litigation that we have had to undertake shows that despite warm words from government saying that it's a key priority from them, that's not been enough to actually secure sufficient action to drive the changes that we need to see. So yeah, hopefully that's answered some of the questions, but obviously happy to discuss this further.
Lovely, thank you very much for that, Andrea. There have been over 70 questions.
Oh God.
So we won't have time to go through them. However, I will do my best to copy all of the questions and see if we can get them answered. And then we can maybe put them on an email that will be a follow-up to this, including a link to the video and any links to where people can find local pollution figures and that kind of thing. But I think a very important question to ask everybody at this stage, and we'll go in alphabetical order, with the speakers. If both Zak and Gary, you can turn your videos and microphones back on. The question is, what can we do to feel more empowered about improving our own local air quality?
I guess I would say that despite what I guess I said in terms of the responsibilities of local authorities, I think it's just very important for people to make their concerns known to politicians at all levels. You know, air pollution for many reasons has been an invisible health problem for a long time. And we're seeing that over the years, through for various reasons, be it our legal action, be it Dieselgate, be it a lot of the evidence that, you know, people like Gary produce, more and more people are becoming aware of this. And politicians aren't going to act unless they think that people are watching what they're doing. So, you know, you need to make a noise, you need to tell your councillors that you want to see action, you need to tell your MP that you want them to take action. There are obviously things that people can do themselves to reduce their emissions and their exposure, but I guess for me, in terms of the work that I do, the most important thing that people can do is just be noisy about it.
Thank you. So the first point there is to get in contact with your councillors and your MPs. That's a good point. Okay, and Gary, what would you say?
I think it's a really difficult question to answer. I feel really cheered by some of the changes in the last few years. We're seeing, you know, in normal times, we were seeing our school kids take to the streets on Fridays, and certainly where I live, they were also holding banners about air pollution as well as climate change. We saw the stuff by the actions by Extinction Rebellion. We've seen things like school streets, and we're just seeing a tremendous change in people's awareness of air pollution and climate change as well. But really, you've got to ask, we've been battling against air pollution, you know, I cited evidence from 1952, so for, you know, longer than the lives of many of us who are in the room at the moment. And why are we still sitting here having the same debates? And the problem is the political will. And many people write to me about air pollution, and they, for instance, are receiving air pollution from their nearby road, from their neighbour's wood burner, and they're worried about the health of their child or the elderly person they may care for. And no matter how much we empower them or how much action they take, they can't stop those sources of air pollution. And it's only by the collective actions of government, which is the way in which we express collective action, that we're really going to combat this problem. So if there's any big politicians out there, or, you know, that are in the, you know, that are listening to this, or even local ones, think about the things you could actually do that could leave a legacy on your community, on your region, country, whatever. And if you could remove the burden of ill health due to air pollution, you could do so much to improve the lives of so many.
Great. Okay, thank you. And finally, Zak, how would you answer that?
Nothing original from me. You know, politicians hold the power to make a real difference here. We can all do a little bit. You know, I'm sure everyone in this call is someone who has done something to change their own lives to tackle climate change and clean up the air, but it is politicians who can make that systemic change. So they need to hear from all of us about what needs to happen. So you can join a campaigning group. You know, you can sign up next week to our new petition that we're launching. You can join a local campaign group. I can see people from Living Streets. There's probably people from Haringey Cycling on here. You know, get involved at all levels and make sure that your voice is heard.
And from a personal perspective, what's made me feel empowered is being able to monitor the air that I'm breathing in. I bought some cheap, low-cost air quality sensors, and there's a way of producing an air purifier that you can use by just simply strapping a HEPA filter onto a desk fan is okay, right? So if you really have a real bad problem with air pollution in your own home, or you want to make sure that your asthmatic children or whatever have cleaner air to breathe, a more short-term notice thing than speaking to your local councillors and MPs, is to try to make your own air purifier by putting a fan onto a HEPA filter. So as I said before, the other questions I will copy and see if I can get answers, and we'll send an email out following this. And before we go, I'm just going to ask that the poll again. So I'll relaunch the poll, those two questions again, if you can spend a minute thinking about them and answering that. We'll see how things have changed since the beginning. We need the song "The Hollies," "The Air That I Breathe," playing in the background. Okay, we've got I would say about 30 or 40 responses so far. So I'll end the poll and share the results. And you can see a huge increase in the number of people who have said that they know more about health risks and generally about air pollution, which is a great outcome for our talk. So I'm very happy with the speakers being able to deliver that content. And the second question, how empowered people feel, is still mixed. So hopefully in the follow-up email that we send out, we'll give you a bit more information about how you feel that you can make a difference. We've come to 4:30, and I'll say thank you very, very much to all the speakers who've given their time to prepare the slides and to deliver it on a Saturday. Everyone listening, I'm sure, will be very thankful for this. And to the Haringey Clean Air group who helped to put all this together. So we can't hear your applause, but we're just going to imagine that we can all hear it. And with that, I think that is the end of the webinar. So I hope that you will have a good rest of the weekend. And you can leave the meeting now, and we'll stay here for a couple of minutes, just to kind of a debrief to the speakers, if you're willing to stay on for another 5-10 minutes or so.